Hello and welcome to this very special Birmingham Live Facebook Live. I'm joined today by Dr Justin Varney, who is Director of Public Health for Birmingham City Council. Thank you, Justin, for joining us. I'm sure you're exceptionally busy. We're here on the first day of second lockdown. Let's start by giving us a bit of an update on how things are looking out in the city in terms of cases and what is the current infection rate?
Great. So where we are at the moment, case rates running about 286 cases per 100,000. That's a little bit up on the previous 7 days. It's about a 3% increase. And what we've seen in Birmingham is pretty much that we continue to go upwards, but we're going at a much slower rate than many other areas, and that probably reflects the fact that we have had restrictions, particularly on household visiting, since about the middle of September, and they've done exactly what they're meant to do. Is they've reduced the number of people we've been meeting up with, and therefore the virus in Birmingham's been spreading more slowly. Unfortunately, it's not coming down though, it's just going up much more slowly, and that's one of the reasons that we've seen these national restrictions come in, is that everywhere's continued to go up and nowhere successfully brought the numbers down.
So as a result of that and the situation that's repeated across the country, sadly, we're now in this new set of national restrictions. Can you just outline for those who perhaps are a little bit confused about what they are, what are the main rules that we need to now be following?
Yeah, so in shorthand, you can't meet up with anyone that you don't live with indoors or outdoors, with the exception of a support bubble. So if you had a support bubble before, that continues as it did last week. If you have a childcare bubble, that continues like it did last week. And if you meet anyone outside, it's only one person at a time. So one person, if I left my house, I can only meet one person outside to go for that bit of physical activity that's allowed every day. In general, you work from home if you can work from home, and you should only leave your house for regular physical activity, going to do essential food shopping, or going for a hospital appointment, for example, or to go to education or to work if you can't do it from home.
So I guess the main question is why is it necessary? Why have we now got to the stage where we need a second lockdown?
So really what we've seen across the country is the case numbers continuing to go up, and that's now resulting in more people going into hospital. Now, it is slightly different from the first wave, because what's happening is people are getting sick, they are going to hospital, but we're better at treating them. Now, that's good because they're not dying as quickly, but they're staying in hospital much longer. So what you end up with is more of a kind of logjam in hospital than we had in the first wave. So in the first wave, people who got sick, got very, very sick, went into hospital and died within a couple of days. Now they're going into hospital earlier. We know they've got COVID much quicker. So we're getting better treatment. They're staying in hospital, though, weeks, for example, and that means that we're taking up more and more hospital beds with people with COVID. Now, unfortunately, some of those are also starting to die, but we think that's at a lower number than and a lower rate than the last wave. So ultimately, why we're having to take action now is that we are seeing increased hospitalizations. It's tracking about 3 to 4 weeks after the rise in the community. That's what we predicted. So what we see in hospital today is really what happened in the community about 3 to 4 weeks ago. And if we carried on the way we were going, then we would very quickly see the NHS be unable to cope. And we're already seeing across the region, across the country, many hospitals are getting to a critical point when it comes to the number of beds that have oxygen available and the number of intensive care beds. And that means we have to stop elective procedures, so people won't get their hip replacements, for example, because there isn't a bed to put them in afterwards. So we're already starting to see that happen. And if we just left it carried on for a couple of weeks more like we were doing, the NHS will tip over. So that's why this fire break's been put in now. It's really to try and get the numbers back up under control. The other thing I would say is that, if there's any chance we're going to be able to see friends and family for Christmas, then we've got to get these numbers down. There is no way we could have carried on the way we were going and people be able to see friends and family, even to have a meal out at Christmas, just wouldn't have been possible because the case numbers would have been so high, and therefore the hospitalizations and the deaths would have been so high. So I think two ways of thinking about it. One, this is about getting things back under control to make the NHS able to cope with the winter pressures and COVID. And secondly, this is our best bet of having any chance of seeing people we love during the festive season in December.
Can I ask, as a follow-up to that, so is there a target? Is there a number, an infection rate, anything that we should all be pushing towards that will mean when lockdown ends on the 2nd of December, I think it's the 2nd of December, we will be able to come out of lockdown and return to some sense of, I say normality in very big inverted commas.
Yeah. So, I mean, yeah, I can only tell you what I think personally and professionally. I know there's a massive amount of work nationally going on to define really clearly for both us and the public about what are the key indicators. What I expect we're looking for, knowing that it will take about 2 weeks for these restrictions to really start to bite and change the direction of travel, is that we'd move from going upwards to staying flat as an absolute minimum. Preferably we'd start to move downwards, but I think if we could get to flat, that would be a really positive sign. We're specifically starting to focus on the case rates in the over 60s, because that ties very closely to hospitalizations. And we've seen the case rates in the over 60s really spike up over the beginning of October and the end of September. So I think that's probably the key demographic we're looking at, is trying to protect those people that are most vulnerable. And through all of that, we need to keep testing rates up and get much better compliance with people staying at home when they have symptoms or their contacts of the case. And the national research shows that sadly, only about 20% or so of people are really abiding by those isolation restrictions. And that's why the virus keeps spreading, because people who've got it are not staying at home and isolating the way that they should.
I've got some more questions I want to put to you, but I notice our comments are starting to pile in, and I want to obviously give our readers the best chance they can of getting your expertise. So very quick one. Chloe Kinsella is a dog training business. She says she's a bit confused about what the guidance is or should be around the work she does. What are your thoughts on that? Is she allowed to continue to work with other people in their homes or outdoors?
So what I would say is, if you're a business, go onto the government website. They've now updated all of the business specific guidance. So that was updated quite late last night. And there is specific set of guidance, which is called working in other people's homes. And that sets out what you can and can't do. If your job, like say you're a boiler engineer and you need to go into someone else's home to do their job, then there is an exemption that allows you to do that. What I would say is, keep in mind what the aim of this lockdown is, to get the numbers under control. And so, do you really need to do it in the next 4 weeks? Can it be postponed for a couple of weeks? Will that make a big difference to the dog training you're doing for the dogs that you're working with? If you can, then please do postpone it. The other thing to think about is you can meet one other person outside. And obviously, if you're training with the dog, you can do that outside with that dog's owner. And I think that would fall under the exemption of being able to meet one other person outside. But you need to just be really careful and think through, can I do it any other way over the next 4 weeks? And is it actually really essential that it happens or not? And that's kind of, we've got to stick with the spirit of what we're trying to achieve, which is get the virus under control.
Absolutely. Several questions are coming in on this, and I think it's one that I was going to put to you anyway. So there's a huge amount of confusion at the moment about care home visiting. Sally Pell is also asking, when are day centres for the elderly going to be able to open? All, I think, based around the same fear that declining mental and physical health of people in care homes is being impacted by not being able to visit them. And obviously making us all very sad who can't go in to visit our loved ones. What's the position? What's the guidance, and what can we expect to happen over the next few weeks?
So we're still waiting for the guidelines. I think they may have been published this morning, and I've just not had a chance to read them yet. Now, my understanding of what's being set out now is an expectation that individual care homes now go through a process to identify how could they offer safe visiting. And you know, the reality is that will be different for each care home because the physical space they have is quite different. So some will say, you know, we haven't got a space indoors that we can make COVID safe, so it will be window visiting. Some will have garden space and they might set up a marquee and do it like that. Some may be able to construct these perspex screens that have been talked about, where you can see your relative, but there's a perspex screen between them. So I think the moment now, each care home's kind of reading what's coming through and trying to work out, well, what does this mean for us? It will be done on a risk assessment basis. So obviously, if there is COVID in the care home, then that will limit what can and can't be done. And we are seeing cases of COVID going up again in care homes at the moment, which is sad. I think there is some further light coming as we get more mass testing available. But that technology, you know, what's being done in Liverpool at the moment is nowhere near as straightforward as it sounds in the news. And actually it's not a massive variation on what we have at the moment in terms of having to go to a test centre, you know, and get your results and stuff. But I am hopeful that would give us a route, for example, for visitors to be able to get tested before they go for a visit. But I would say we're at least 4 or 5 weeks off that becoming a reality because the kits just aren't there and the system isn't there yet. So please give your care homes a bit of space and let them process what's come through from government. The announcement was made last night. The guidelines have come through this morning. They've got to have a bit of time. So I would say touch base with them next week and ask the question rather than chasing them over the weekend, because it will take a bit of time for them to work out what's safe and what they can do for each individual home.
Absolutely. The other hot topic, and I know you've been asked about this quite a lot, is whether we should or shouldn't have schools open during this lockdown period. Will it diminish the impact of the lockdown and all the other things associated with that? Again, we're seeing lots of questions coming in about this. One related, actually, as a dance school, why are we made to close but schools can continue, asked Chloe. So okay. I don't know if you can address some of those key points. Should schools be open, and if so, why?
Yeah, so I'll try. Let me do the dance school one first, because I think the physical activity indoors in general is stopped at the moment, and I think that would apply to the dance school. But if it's a registered school, then it's worth them having a conversation with the council, whichever council they come under's education and skills department, because if it's a registered school, then it comes under the school guidance, and there's no difference about whether it's a dance school or a theatre school, for example, or anything else. If it's not a registered provision, so it's more like a club that you go to, like a judo club, so this is a dance club where you go for dance classes, then it comes under the out of school provision, and there are quite tight restrictions on that. You can only hold those type of clubs if they are being provided to enable parents to go to work, and you've got to be very clear that you meet that exemption criteria. So in terms of the schools in general, what we're seeing is that, particularly in primary school, the rates in primary school children haven't really changed since in Birmingham since about certainly August or early September. They've stayed pretty stable. Children under 10, it's almost the same number every week. It's quite strange, actually. And what we're seeing is that younger children don't seem to be very good at transmitting it. And And we've talked a bit, I think, about this before, Jane. You know, some of it might just be that they're all at waist height, and therefore they're not very good at projecting it up into adult faces. Some of it may be just they're not as strong breathers, you know, and they don't project the droplets as far as older children. We don't know. But it's very clear that they don't seem to be particularly good at transmitting it. Now, secondary school children, slightly different, and that's why you've seen some change in the guidance this week around secondary school children wearing face coverings in secondary schools, and same for students in university if they're not at their desk. And that's really to try and reduce that transmission risk even more. The evidence from what I've seen nationally is that closing schools doesn't really make a huge difference to the height of the curve, but it does make some difference to where the peak falls. So it doesn't really bring down the case numbers, but it might defer them and make them the top be a bit later. And I think we may well see further development of the guidance around how secondary schools function and universities moving forward. But we'll see. And as I say, the face coverings is probably a step towards that. I noticed there was also a question about if children live in a house with a vulnerable person, does it make any difference at the moment? So the answer is no. If you're clinically extremely vulnerable, for example, and you've been asked to shield, it's what I'd call shielding light. So you're asked to work from home if you can and stay home as much as possible. The people you live with don't have to stay with you, but they should be super vigilant. And my top tip on this is a website called germdefense.org. So it's germdefense.org. It's a free website. It's available in about 21 different languages. And it's designed to help families work out how to keep safe at home. So it was originally designed to stop diarrhea and vomiting, but it's been updated from COVID. It's endorsed by Public Health England, and it really helps you, for you and your circumstances, work out how do you protect. So say it's granny or granddad that live with the family. How do you keep them safe if one of the rest of you has caught COVID, and how do you stop it spreading in the home? So I'd really recommend germdefense.org to any of those intergenerational families or families with vulnerable people. But it is really important kids still go to school. We know that there's been a really negative impact during the first wave, not just on kids learning, but actually on their mental health and their well-being. And that's what we're trying to avoid this time.
Absolutely. And there was one final bit of that question, I think. Are teachers safe? Again, this has come up through the unions, but also from some teachers really, I guess, quite anxious about their own well-being. What are your thoughts on that?
So, I mean, certainly in Birmingham, we've worked with the schools in quite a lot of detail on their risk management. They use a similar kind of risk profile for staff as the council uses, and we based ours on the NHS. So there's a pretty standardized approach across the public sector, actually, about assessing risk, so that staff who are extremely vulnerable avoided coming into face-to-face contact with anyone else, not just with the kids, with other staff. What we've seen in terms of the last couple of months is where teachers have got COVID, it doesn't appear to be from children in their classes. Where teachers have caught COVID, we're often seeing it's transmitted between teachers. Some of that's car sharing. Some of that's about socialization outside of school. Some of it's about what people do in their lunch breaks or their breaks during the day. And that's no different from any other workplace, actually. We're generally seeing when people are doing their job or they're teaching or they're treating their patients, they're really good at COVID safety. When they go on a break, they forget. And that's when the virus seems to be spreading.
Absolutely. Great stuff. Thank you so much for that. I'm just having a quick look through. I don't want to miss anybody's really important questions. One thing that is coming up in a couple of questions is, isn't this just a type of flu, or words to that effect? Can you just explain to us why this isn't a type of flu, if it isn't, and why people should perhaps be more concerned about it than they maybe are?
Yeah, so it definitely isn't flu. It's a different type of organism. So if you look at it under a microscope, it just looks different, but it also behaves differently. So, sorry. So flu is a respiratory illness. It predominantly, people get very sick because when you get severe flu, you have real problems breathing, you get fluid in your lungs. So we would call that pneumonia. And that inflammation of the lungs. And that's what causes you problems. Now, COVID does do that, but it also does other things. So it seems to interrupt people's clotting. So they end up with blood clots. It also gives them very high fevers. And with flu, you don't necessarily have that same pattern. And it really seems to just disrupt a lot of your body systems. So people end up being much sicker with flu. And although people do end up in intensive care with flu every year, and that's why we're so focused on the flu jab, in general, it's our very elderly or people who've got quite serious other health conditions. In COVID, those people are much more vulnerable to COVID, but COVID is also putting people in hospital who were otherwise fit and well. And Jane, you'll remember there was the policeman I think you covered right back in wave one, who was a really fit and well bloke who ended up in intensive care with COVID. And so it's a really important reminder, actually, that, flu is bad, but COVID is much worse. And also, you don't want to get flu and COVID. So if you're entitled to a flu jab, please go and get it, because flu and COVID will almost certainly put you in hospital and potentially put you into intensive care. So really, if you can knock off one of them by having the flu jab this year, please do get it.
Absolutely. I'm going to go back to some quite specific questions. I've got one here from Amy, Amy Goebel, who's asking, what happens if you have a childcare bubble and a grandparent in that bubble who shielded previously? Can or should the child still go to their house?
Yeah, I mean, I think this is quite a difficult one, to be honest, because childcare bubbles, there aren't any restrictions on who you can and can't form a childcare bubble with, but you can't move it around. So you can't have it one day with one set of grandparents and the next day with the other set of grandparents. It's like a social bubble. Once you've formed it, it's pretty much locked in for the duration. What I would say in terms of childcare is, do think through about who you're giving them, who you're giving your kids to, and the risk to them as well as to you. If it's an older child, so it's your teenage son or daughter, for example, I'd probably be a little bit more comfortable about them going to a grandparent who's previously shielded, because they can be sensible about the restrictions. They can keep social distance. They can be conscious about washing their hands, and they will really understand the message about protecting granny or granddad if they're in the house. If it's a younger child, I think that's more challenging because, particularly if it's, say, a 1 or 2 year old, very, very hard to keep that social distance. You've got to deal with nappies, you cleaning up, all of that, much hard to keep the difference. So it's slightly different about how nervous I would be, to be honest, based on the age of the child. The regulations don't prevent it, but I would say think carefully about it. If you haven't got any other choice, you just need to be really careful. But if you have, then I'm afraid I would probably go with the other relative that could provide the childcare rather than the one that's been shielded before. What I would say is shielding's different this time. So the letters have gone out from the NHS over the last day or so. It's a smaller number of people that need to take this shielding action, so staying at home and working from home, than it was last time. The list has changed slightly. So there've been some additions. So this now includes adults. I should say it's adults with Down syndrome are included in the list, and they weren't previously. But children have been taken off the list. So children who previously had to shield don't have to shield this time. And that's because what we've seen is actually the evidence is that children with serious health conditions don't seem to suffer from COVID particularly badly. They're like every other child. When they catch COVID, it just doesn't seem to hit them in the same way. So it's just important to keep that eye out. If your grandparent got the letter, I'd be more cautious. But if they haven't had a letter or a text message by Saturday, and that's just to allow for the vagaries of the post, then then they don't need to shield this time, and you're probably in a safer position.
Fantastic. A couple of questions about what counts as an essential shop and what doesn't. So Paula Burnham tells us that she's seen carpet shops, cake making suppliers, estate agents, and a vape shop all open today. Others say barbers and hairdressers are clearly among those that have been deemed necessary to close, along with gyms. There is a sense that some of these businesses have worked really hard and invested quite a lot of money to be COVID safe and have not seen cases and feel it's very unfair. I don't know if you can talk through how that difference between essential and non-essential has been worked out.
Yeah, so just to be really clear, some of those shops, if they're open, should only be operating click and collect. So that means someone's pre-ordered, a bit like you remember you go to Argos, for example, or I think you can do it at Homebase, some of the other stores. You've ordered online or you've rung up and you're going to pick it up. There should not be people going into that shop and mooching around and having a wander. That they're not allowed to do that, particularly, and the guidance is very, very specific, actually. I've just got it up in front of me. It says non-essential retail, such as clothing and homeware stores, so that would cover your carpet store, vehicle showrooms, betting shops, tailors, tobacco, vape shops, electronic shops, and mobile phone shops, market stores selling non-essential goods. These venues can operate click and collect, where goods are pre-ordered and collected off premises, and they can operate as delivery services, but they can't operate in the same way a supermarket does, for example, where you can go around and wander around and have a mooch and a discussion. Estate agents are slightly different because you can still move house. So estate agents do have to remain open. So estate agents can run viewings, but again, people shouldn't be going into estate agents to sit down and have a conversation about what they want to do. That all needs to be done over the phone. It's simply that they're open to be able to run lettings and viewings. If you do see a premise that's not complying or doing something you don't think is right, Birmingham City Council's got a whistleblowing site. You go onto the council, you can report it to us, either by telephone or through the website anonymously, and we then go out and visit the premise and have a conversation. And we were doing that over the last couple of months. We'll still be doing it through this. But in general, just look a little bit closer. They should be doing either drop and collect or deliveries, but there shouldn't be people wandering around the aisles having a mooch.
Fantastic. I'm going to go back to some of those questions, but I'm just going to ask you another one. Test and trace is seen as one of the kind of key tools to getting on top of coronavirus. And lots of people are saying this lockdown is partly so that we can make sure that test and trace system is absolutely top notch. What is the current situation? How is it working at the moment? Are we tracking and tracing people in the way that you'd hope?
I would say I don't think it is working as well as we'd like. When I last looked at the data a day or two ago, we had about 72% of the people being contacted by the NHS test and trace service who had COVID were completing the paperwork and going through the questionnaires. And that compares to about 78, 79% nationally. So it's lower here than it is in other areas. And I think that's disappointing. Some of that's about the service and the way that the service works. Some of it's about people just not engaging. And when you look at the contacts of cases, then it comes even lower and it drops down to the kind of 50, 52, 53%. And, at that level, it really isn't doing its job. I think, I understand that nationally there's going to be a complete overhaul of the process during these 4 weeks. Because also at this point where the case numbers are so high, it also gets to the point where it becomes a bit meaningless to try and trace people in this way. So I think over the next 4 weeks, we will see a slightly different approach to test and trace coming through and to the NHS system. And that hopefully will be an approach which is much easier for people to follow.
Absolutely. One quick one that I just flew by my eye, asking, are we allowed to travel out of Birmingham? I'm just trying to ask that. Yes, it was Mel Farrand. Are we allowed to travel out of Birmingham?
So the advice is basically don't travel unless it's essential. So if you need to travel out of Birmingham for work, or for study, then you're allowed to do that. If you have your support bubble outside of Birmingham, so say your support bubble is in Walsall, you can travel with your support bubble. And if your childcare bubble is outside, so say your childcare bubble is in Solihull, you would be able to travel for that. But really, you should only be traveling, you should only be leaving your house if it is absolutely essential, or for work, or for education, or to see a doctor, to see your GP or your nurse or your doctor and your GP. So I think that, those are the reasons. You're not allowed to go on holiday. You're not allowed to stay overnight anywhere that you don't live, unless it's for work or unless it's part of your social bubble or your childcare bubble. But other than that, you should be staying at home for the next 4 weeks. It's a good time to get on with all those DIY things that you promised you'd do in the first wave that you didn't get done.
We are continuing, and I'm trying not to ignore them because I think it's important that we address some of these things. Continuing to get lots of questions comparing coronavirus to flu. Some of these are asking, the death rate from flu seems to have magically disappeared, and instead we're having people dying of coronavirus. Why aren't we seeing people getting flu this time, etc. I think you can kind of get the gist of it. So again, I feel like we've asked you this already, but what can you say to people who are, who continue to think that flu and coronavirus are linked
So I mean, I suppose what I'd say is the reason we're not seeing as much flu as we would in normal years is because the things that stop the spread of coronavirus also stop the spread of flu. So flu is also spread through droplets. So that's why in flu season, we often have that catch it, kin it, bin it type thing around flu. So if you have got a cough or a cold, make sure you're catching it in a tissue and binning it. So that's one of the reasons that we're not seeing as much flu this year. The other is that we've started vaccination a little bit earlier than we would normally with the flu season. So normally now people would start to be getting their flu jabs, and we started that back at the beginning of September. So that's also brought down the flu numbers. The final thing I'd say is that in a normal year, we don't normally see lots of flu until December, January. So when you look at hospital admissions for flu in a normal year, really we see really very little in October and November, and then late December they really start to pick up, and usually the peak is kind of end of December, beginning of January. So I wouldn't expect anyway to see a lot of flu at the moment in a normal year, but I'm hopeful, and this is certainly what we saw in Australia, because their flu season was back during the summer when they had their second wave of COVID, was that we hopefully will see less flu, because if we're doing all the right things for COVID, that will stop flu circulating. But they are different diseases, and we do know that if you get both of them, you are likely to be very, very sick. And that's also evidence from Australia that flu and COVID is not an experience you want to have.
Magda is asking, Magda Centrala, which parts of the lockdown measures are advice and which are legislation? I don't know if you can answer that in a nutshell.
Well, I would say, I kind of would say, why do you want to know? Because we need to follow all of them. The reality is there are some things that are in legislation. Predominantly they're ones where we need to, the government needs to have legislation to be able to then fine people if they don't abide by them, or where we need to make sure that shops close, for example. So there are things set out in the regulations which are quite clear about which shops can and can't open, and that means that if a business doesn't abide, we can do something about it. There's also quite a lot in the regulations that were passed this week, which is really explicit about how many people can meet outside, and what constitutes a gathering. most of the regulation is actually about what you can do. So it's all about the exemptions rather than the rules. So the vast bulk of the new regulations say these are the reasons that you can do it, rather than these are the things you can't do. And I think that, you know, that's what regulation is really about. My view is, you know, if government is saying don't do it, don't do it. Don't spend a day trying to work out why you can find some little loophole to do it, because, you know, what you're doing is putting yourself at risk, your family at risk, and your community at risk. You know, the decisions we each make every day are the things that will bring this virus under control. If we choose to follow the guidance and we choose to make the right decisions, then we will keep the people we love out of hospital, and we'll keep this city going, and we'll get the economy open faster, and we'll keep jobs, and we'll keep livelihoods. If we all go, oh, this is all myth and conspiracy theory, and I don't believe it, and we all go running out and mixing and mingling, we will see case numbers continue to rise. We'll see more people die. And just to remind people, we've lost over 1,400 people from COVID in this city. And that's after they cleaned all the death data. This is people where COVID was definitely contributed to their death. Now, in the Blitz, we lost about 2,000. So we're certainly heading in the wrong direction. And it's a horrible legacy to say this has cost this city more than World War II did. So, you know, it's the decisions we make every day that matter. And I don't think we should be looking for loopholes. I think we should be looking at what we each do every day that's going to save lives, because it's up to us to make the difference.
Justin, thank you. I think you've articulated what several people that I've been speaking to today who currently have COVID or have loved ones who've got COVID, a growing sense of frustration that some people, for whatever reason, and fear may be a big part of it, are unable to or unwilling to accept what they're being told. One very specific one here from Julie Bergin, who posted this at 3:43. Thank you, Julie, for your question. I understand that 15-minute COVID tests were rolled out to the NHS last week, and that maternity is being treated as a priority so that partners are able to be present through antenatal appointments and the entire labour. How soon do you anticipate these will be in use in maternity wards? I don't know how well up you are with what's happening inside a particular hospital, but if you can give us what you know about that, that would be great.
Sure. So there are a couple of new technologies coming at the moment, and this is what the government, I think the Secretary of State called Operation Moonshot. And there's been a whole load of work on different types of tests which give faster results. And one of those is what's called the LAMP test. So it's not a different type of test. It's just the kit in the lab is faster and it can process results much more quickly. And now that's now being piloted in the NHS. So that's how they're processing those results faster. And the plan is to build on that. Once we know it is accurate and it can be done quickly, and the process, all the paperwork that has to go with it, which is not insignificant, flows, then the aim would be to extend it to things like partners joining for the birth of their child, outpatients. My hope is also we'll start to see some of these technologies applied for care home visiting. Potentially it'll be a slightly different bit of kit. So there is quite a lot of hope there. But I do want to also just temper that with a bit of reality. You know, the LAMP technology, those machines are extortionately expensive. There are only a certain number of them in the country that have been built so far. So it's not like, you know, everyone can have it tomorrow and every hospital can have it tomorrow. So the government is getting them out there, but it can't just all happen overnight. It's the same with the rapid result tests, that what are called lateral flow tests that they're using in Liverpool, and Stoke have had a pilot of these recently. You know, the bulk of those kits won't be available until the middle of or late December. But, you know, we are starting to get some through nationally in different areas to test and learn how to actually use them effectively. So there's a lot of stuff coming in the pipeline, which I think will make our lives a lot easier. And certainly for visiting friends and family in care homes and hospitals, I'm really hopeful about this. But it's not going to happen tomorrow. My best estimate, it probably will see start of this making a big difference around the middle of December. So that, think in that kind of time scale rather than it's going to change things immediately. So I'm really sorry if your baby's due next week. I think it probably won't be in place for that, but hopefully if your baby's due a bit later, then this will all be sorted and running normally by then.
We are certainly starting to see more glimmers of hope, of us coming up with solutions to help us, you know, get more of our kind of normal lives back, if you like. One question has come in from Tony Roy. I think he put this in about 3:38, but it touches on vaccines, which again is another thing that we're all hoping and waiting for. So I'll ask initially, what do you think are the chances of us getting something pretty quickly? And then Tony is asking, will it be compulsory, basically? So when we do get it, will the mass vaccination program be a compulsory one?
Yeah, so let me do that in reverse order, Jane. So first of all, the NHS does not give any vaccination compulsory. It's one of the very first things we learn in medical school. I think many of you viewers know I'm trained as a GP. You know, we go through these ethics classes, and one of the key questions you always get asked is, you know, can you give a vaccination to someone who doesn't consent? The answer is no, because then it's what's called assault and battery. So, you know, you have to be very clear on this. When a vaccine is available, there'll be information. People will be invited to have the vaccine in the same way they are for flu or for children to have their MMR jabs. You know, and it's up to you whether you want to have it. Frankly, I struggle to understand why you wouldn't want to have it. And we're not expecting this vaccine to contain any of the pig products that cause issues for different communities. You know, my understanding, all of the main ones in trials at the moment don't have that as an issue. And, you know, if this vaccine has no side effects or very few side effects on the day, and protects you from a virus that not only you could hurt you, but could hurt the people you love, why wouldn't you want to take it? Now, where we are at the moment is that there are many vaccines in trials across the world. I think it's about 10 that the government has bought stock of, so it's hedged its bets and backed a whole load of horses in this vaccine race. There are 2 front runners at the moment. What I know is that the ones that look most likely to get through the final stage of their trials, which is where most of these vaccines are now. So they've done the test of, does it work in the lab? Yes. Does it work if we give it to a small number of people? Yes. Is it safe and does anyone have reactions? No. Does it work if we give it to people of different ages, different ethnicities, different genders? Yes. When we give it, does it give people robust defense if they're exposed to the virus? And that's the final stage of the trials that the majority of the vaccines are now in. Now, those should come to an end probably by the end of November. And if the answer is yes, it protects people when they're out in real life situations rather than just when they're in a lab, then we will start to see those vaccines rolled out. I expect, and this is me just crystal ball gazing for you, Jane, and viewers, is I expect that the first call will be on care home residents and care home staff, because they are by far the most vulnerable. Then I think it will be NHS frontline staff in our accident and emergency and our intensive care places. Then I hope it will be wider essential staff and those that are eligible for the flu jab at the moment. So particularly the over 60s, people with long-term conditions as well. And then it will be everyone else. And that's a lot of people to get through. So if we work on the basis that everything goes to plan, we'll get the first vaccines approved in December. There'll be very small numbers to begin with, because once we know the vaccines works, that's when they start to manufacture it at scale. And then it'll probably be about 3 to 6 months before the first round of vaccines have been given to everyone. And the other thing I would say is most of the vaccines that are looking most positive require 2 doses. So you're going to need 2 jabs of this, probably about a month apart. And you can imagine all the paperwork that's going to be involved in that. So it's a major procedure, major logistics operation. And that's what the NHS is planning for at the moment. So you will have seen in the media, NHS is doing lots and lots of planning of how do we actually do this if we've got to give everyone in the country 2 jabs a month apart? That's not an easy thing to do. And then also, if we've got to prioritize it, do we know how to identify people? Where would we do it? Where do we store all of those bits and pieces? But I have to say, I'm much more hopeful than I was probably a month ago that we will have a vaccine by the end of the year that works. But I still think that means the majority of us won't get access to it until the late spring at the very earliest next year.
We'll put that in the diary and come back to you in late spring. There are 2 more things. I'm very conscious that we're now at 5 to 4, and you have a 4 o'clock whiz off. So one that I think is really important to a lot of people and has really exercised a lot of people. There are real fears about the mental health impact of this pandemic. Are you seeing specific problems emerge kind of for a lot of people? And do you think people are able to access the help they need?
Yeah, I have to say, this is an issue. Let's be honest about it. I think all of us, and you know, Jane, you know, I've talked about how hard this is on my own mental health during the last 6 months, and how difficult, you know, times it is to live through this. And you know, I think the NHS, who commission most of the mental health service, have been really, really strong on trying to make sure that services are accessible, that the services can be delivered by telephone or virtually, and that there are services that can be delivered safely face-to-face if people are in crisis. Many of the mental health charities across the city have been really stepping up through the first wave and since to try and help people manage, particularly around bereavement support. So charities like Cruise, for example, have expanded their support and services. And I remember that was something that we actually put additional money to back in March, but it did take a time to get the people recruited, the additional therapists. I know that BirminghamLive, for example, have been running additional sessions, additional support groups. The universities have been really proactive, supporting students, really worried about students isolating and making sure their well-being is supported as well. And you know, some of our community organisations like Birmingham LGBT, particularly concerned around some of our minority communities and really focusing some additional effort and there as well. You know, the reality is that these restrictions are really hard. They're hard on everyone, and all of us experience them in slightly different ways. You know, some of us, it's really hard being away from friends and family, not being able to give your mum or your dad a hug, or to be able to see your partner because you don't fit the criteria for the bubble. You know, some of us, it's the additional pressure and the stress of work. And whether we will or won't have a job at the end of this or during it, particularly the uncertainty of the furlough scheme, which I'm really glad has been clarified today and will be extended, I think, till the end of March, which is brilliant news and will help a lot of people just get that bit of reassurance. You know, and simply just not going into work actually is hard for many of us. Not being in the office, being able to have those chats and see other people has been really difficult. So it all impacts on everyone differently. I think on the service side, we've done what we can to expand services and make sure they're accessible. We've been running the Be Healthy campaign, which you can look up on the council's website. It's available in over 20 languages. There are 16 webinars that go into more detail about topics like sleep, physical activity, healthy eating, simple things that we can all do that make a difference. And I suppose my kind of 2 top tips on this, if I say from my own experience, is first of all, use the exemption that allows you to leave the house to take physical activity every day. It's too easy to spend 2 or 3 days and never leave your desk and never leave your house, whether you're working from home or not. So make sure you get out every day, even if it's just for 5 minutes, leave the house and have a walk. And secondly, it's talk about it. Talk about your mental health. Even if you're doing a Shirley Valentine and talking to the wall, talk about it and talk about how you feel and how when you're having a good day, when you're having a bad day, because it's so important that we do talk about mental health. And if we are struggling, we reach out for help, and we make it easier for people who are struggling by talking about mental health. So please do talk about it. Please reach out for help if you are struggling, and please leave the house at least once a day, even if it's only to the end of the street. It does make a difference, and it will help you get through this.
So I'm going to end with what can we expect? We've got 4 weeks. If we all follow the rules, what do you think will happen at the end of it? Will it work, do you think?
I think if we all follow the rules, then there's a pretty good chance it will work, frankly. I think if it had been 2 weeks, I'd be a lot less positive. The reason I think the 4 weeks is the right amount of time is we know that someone who has it is infectious for about 10 days, or mainly infectious for the first 10 days. People who then get exposed in that 10 days take up to 14 days to develop symptoms, and then they're infectious for another 10 days. So you need basically 24 days to be sure that everyone in the house who could have got it has got it, and got to the point where they're no longer infectious, to be safe. And that's where the 4 weeks really works. I think the 2 weeks would have been too short, and it wouldn't have allowed to cover, whereas 4 weeks I think is probably a reasonable balance between trying to make sure everyone who's got it isolates it, we limit the spread as much as possible, and also what people can tolerate. So I am hopeful that in December we will see relaxation. I'm really hopeful that if everyone does what's being asked, case numbers will come down, particularly in those over 60s. And that means we'll see the NHS numbers come down, and that will buy us some flexibility for the festive season over Christmas. Whether we go back in again on the other side, not sure. It will depend a little bit on how wild people go if there are relaxations. And I do think we'll come out of this probably back into the tier system. So it's really up to us. If we're all really, really good over the next 4 weeks and get this under control, there's a good chance we could get back down to tier 1. If we're not, we could stay stuck in this, which I think will probably be a new tier 4 coming out. So, everything to play for, but it's up to the decisions we each make every day on what will come out on the end of this. And keep in mind that this is not about doing it for government. It's not about doing it for Birmingham. It's about doing it for the people you care about and love. If you limit the spread of this virus, you will protect the people that you value and care for. You'll keep them out of hospital. You'll keep them from dying. We've already lost too many people. We need to get this under control, and we need to prevent us losing thousands more in the coming months and weeks. So it really is the decisions we each make that will make a difference to this.
And on that note, I think that's a great place to wrap it up. Thank you so much, everybody who's joined us and submitted some questions. I hope we've covered most of the themes and most of the questions that are being asked. I'm sure more will come in the days and weeks ahead, and the guidance does change a little bit, so we may get some more updates. But for now, thank you so much, Dr. Varney, for joining us, and thank you anybody who's come along, and we'll bring it to a close. Thank you so much.